you. Very nice to meet you. Well, look, it's absolutely great to be here. It's the I feel like we've done so much together, and yet I've never actually been on site at Trelisk. So,
welcome.
you know, I feel like I know it.
Well, we've got holes in the ground to show you.
Holes in the ground. I love a good hole in the ground. I told you I needed my hard hat.
I know. Yeah. We're going to stand you on the gantry, so you don't need to go down, but you obviously how big the hole is. And then we'll show you where the Women's and Children's Hospital is going to
go, and then let's talk about how we're going to make it happen.
Absolutely.
Yeah. Okay. Now able to get going and get building, as you can see. So we're going to have a new oncology centre, new MRIs, all about investing in the NHS right across the board. Well done. Right. Another key part of the plan. Yeah. So you built that at pace last year, didn't you?
Absolutely.
Yeah. It was amazing what we managed to do. You know, when it was obvious that EDs needed to.
Shorty side, salad side, children's goes in the middle.
Goes in the middle. This is where it's going to be.
Yeah. This is it.
So this is the
Yeah, you're
spot.
standing.
The footprint, just back. Fantastic.
So one of the biggest kind of changes that the new build will bring us is that our HDU will be located in the middle of the ward.
Yeah.
So where all the nurses are, the medics. So although there's always a nurse in HDU, they are quite isolated away from the rest of the team.
Yeah.
So I'm not able to take you in there now because we've just had an admission in there.
Sure.
But yeah, so that's one of the biggest things.
And have you been involved in the plans?
Absolutely, we all have, yeah, absolutely. So we're really hands-on, all of us have been involved.
Yeah.
The ward managers, the consultants, the doctors, definitely. We've had some parent involvement as well.
Yeah.
And so the next step for us will be to get some patient involvement in that as well, because it's quite often it's very different what we think is needed to actually what a 10-year-old might think is needed or a teenager. So that would be the next stage for us.
Or some parents bringing a small child.
Yeah, absolutely. So we've done a lot of work previously with children and families. We've held takeover days where they come in and improve the environment for us. So they'll be doing that with the new build. So
you know, my sense is nationally we haven't in the past put enough investment into peds, into women's health. Across the board,
absolutely.
We've got a whole women's health strategy which is all planned on asking the questions that for years haven't been answered enough.
Yeah.
And this and other women and children's hospitals across the country is a physical response to that, in my view, underinvestment in women's health.
Yeah, absolutely. Absolutely.
But I'm really glad that you're involved in designing it, because then it will be practical to use and
we've changed the plans several times actually with direct feedback from the people that will be working on the wards, because that's really important as well. So it's not just about the sort of parent and child involvement in it, but the staff have to be comfortable in the environment they're working in as well. So when the first initial round of plans were brought out, we put them up on the wards. Everybody was able to write on them and you know put their ideas.
Them.
Yeah, absolutely. And so what the plans that we've got now have changed from the plans that we initially had sent out to us, and that's direct feedback from all the staff.
Yeah.
So it's really exciting, we're really energised about it. It's definitely needed in Cornwall. The environment, I mean this ward in particular, Polkeris, we've got an admissions unit at the end, and then we've got 12 beds for 0 to 11-year-olds, but there's been no real upgrade here for, well, as long as I've been here, and I've been here 25 years.
Right.
Some of the rooms you can't get beds into properly, the sinks you can't put your hands in properly, you know, it's really, really needed.
Yeah.
And it's just all going to benefit the families of Cornwall, so that can only be a good thing.
Hello,
hello,
sir.
I'm Dan, ward manager.
Yeah, right. Okay, very nice to meet you.
Yeah, and you.
So I was just hearing from Mel how you've been involved in the design of the new project. I'm here really to look at the plans for the new Women and Children's Hospital.
Yeah.
And you know, see where they're up to, see what we can do to move that forward.
Yeah.
And you've been involved in that?
Yeah, very much so.
involved.
Yeah, very much. Obviously, putting together sort of where we are now in this. Obviously, kind of reiterating what Mel's just talked about, but the kind of state of play on this ward and what's required for sort of the children that we look after now and for the future, really. So it's just kind of putting together a good sort of setup that'll last. It'll last, yeah, and it'll meet the needs that we've got.
Dan's our budding architect, so Dan's got a real eye for the plans. So you've put quite a bit of challenge back in the plan, professional challenge, to make sure that they're right.
It's getting the environment right for patients and for staff, because if you get it right, then it means you sort of provide you're more efficient at what you're doing. It's a good environment to work in. Which helps with the sort of the training of staff and keeping hold of staff as well, because if the environment's rubbish, it doesn't lead very well to sort of keeping hold of people. So, So
very good, great stuff, very impressive. I think it's the way that you both talk about it is very it is. And you've obviously been the critical thing is, as we design these new facilities, that they work for you and for patients, and in the case of PEDS, the parents of patients as well. And you can only do that by iterating the plans and working with the people who are actually 100%. On this day to day, rather than sitting in some some office somewhere.
No,
definitely. So it's getting that design right is the key to it all. I think, because it will help. And I don't know if you've seen any of the cubicles here, sort of the size of them, but where obviously when these were sort of conceived many years ago, children were sort of the complexities that they came in with the technology and equipment was not nowhere near as much as now. Whereas if you get a child with complex health needs with their family in, the size is just having to sort of put stuff everywhere just to kind of accommodate them. So that's the bit that we have to. That's the challenge we've got to meet.
Very good. Fantastic.
Thank you.
Very nice to meet you.
Nice to meet you.
Terrific.
Oh,